Hi guys, how we doing? This is Greg from the YouTube channel Growing Older Gratefully. It's about 9 p.m. Central Time here in Fort Walton Beach, Florida. I hope everybody's having a good night out there. I wanted to touch base with everybody tonight, just to let you know, one, how I'm doing, but I also wanted to talk, two talking points I had tonight was how I am personally doing, but secondly, earlier today I was doing some research just generally on recovery of knees and hips. So I just wanted to touch upon those 2 points tonight, because what I had mentioned yesterday was talking to a friend in Illinois, and then on Monday talking to the woman at the rehabilitation center where I'm doing my therapy. For lack of a better word, kind of freaked me out. Talking to the two ladies had me concerned about recovery. So having said that, let me just tell you a little bit of what I was doing some research on. So I wanted to see about recovery and about what articles and so forth were saying, like what is the average recovery. And what I found is they said pretty much, knee and hip, your average time for recovery, you're looking at a good 10 to 12 weeks, and that's to get back to pretty much a lot of your normal activities. So with that, I think that's where a lot of us make the mistake where and as humans, that's the way we are, you know that, guys, where we want that instant gratification, or we're thinking within weeks, because actually the few articles I read said that light activities is more like your 3 to 4 weeks, and it takes you truly to about this 10, 12 week mark to where you're possibly back to the way you were prior to having your hip or knee replaced. So with that, I looked at that like that was a good thing, because like I said, I was kind of a little bit spooked by what the two ladies were telling me, and I thought, oh gosh, this is going to be one heck of a road to recovery, but I'm still in the early stages. Quite frankly, so are they. So for me, that was a very good thing to find out that, hey, I'm looking at a good 2.5, 3 months just for getting kind of back to where I was, for the most part. The other thing I wanted to say, and this gets back to early on, when I was saying that do not hesitate to go see your GP, and then eventually take that recommendation from him or her to possibly see an orthopedic surgeon. Because what I found is that I've looked this up where it said that for someone the average age of 45 to 54, that there's been an increase in the last 10 years or so of over 200% of that age bracket having knee and hip replacements. So I find that to be incredible. Hell, I was in the dark because I was still going under the old pretense that, hey, if you weren't over 60 or closer to 65, they really don't want to touch it. But apparently that isn't true. Like I said, overall, the replacements as far as knee and hips are well over 200%, because obviously you're factoring in the younger generation. What I also discovered, I did read one article because I was curious about, well, what is about the oldest they would do it? And there was one orthopedic surgeon, he said, well, he's had a client 100 years old. God bless him, that all of a sudden he got a new hip. But so the surgeon was saying, that notion of you're too young, you're too old, that's not true. Things are on an individual basis with the patient. So regardless of where you stand age-wise, don't let that hinder you to think, oh, well, heck, I'm not going to get a new knee or hip, because that may not be the case. So like I said, definitely follow up with your GP and hopefully get an appointment with an orthopedic surgeon, and he or she will tell you whether you can. Another thing I found to be interesting, and this is what my surgeon himself had told me, that with the way the parts are for knees and hips, they last a long time. So this was very good news, and definitely went in agreement with what he was telling me. It said at about 80 to 85%, of the replacement parts for knees and hips after surgery were working well after 20 years. So that went definitely with what my surgeon was saying, where they're built to last 15, 20, 25 years, So I was impressed with that too. One thing I wanted to kind of close up what I'm talking about as far as with the research. Now the other thing I wanted to look into, now with this, at least in my opinion anyway, this didn't have too much to do with the woman who was working out with me, who's doing therapy with me, and definitely my friend in Illinois, was when it comes to what they consider obesity. An article I read said that the amount of hip and knee replacements are increasing quite a bit, and they attribute quite a bit of that to the fact, guys, that hey, there's a lot of obesity in America. There's a lot of obesity in the world, but unfortunately, as Americans, we're near the top of that. So that was another thing that you have to be careful. Now, on a personal note, when it comes to the weight, before I got to the point where I was not able to work out, I wasn't able to race walk as I had done in the past. I was getting to the point I couldn't even walk. So I will say, on a personal level, my weight went from 205 to where it is now, which is anywhere between, I've been fluctuating the last 2 weeks between 240 and 245. So clearly with me, I'm 35 to 40 pounds overweight. Once I'm able to get resume back to where I can actually, not doing therapy, so to speak, but working out again, my goal, and my surgeon loved this, was, hey, I need to get back to 205, even 210, because I've got to get that excessive weight, which definitely will help me. Well, it's going to help me if I'm starting to lose weight now, because like I said, I'm down probably about 5 pounds from before surgery, but I definitely have to continue to work on that, because that's going to help me, one, with just the sheer recovery, but after the recovery of getting back to a level, if I hope to eventually race walking, and being able to do that with not so much kind of eliminating some of the fears that I'm going to injure my hip, which soon will be 2 new hips. So that definitely plays into it, the obesity part, beforehand, but the obesity part is going to play into it. Now, a little side note, and maybe you guys may find the humor in this that I find in it, but through the years, I've always found that this is back when I lived in Illinois, Indiana, Nebraska, here in Florida. You go in to see your doctor, and they've got these charts. They got these BMI charts. They say, okay, Greg, what are you? Oh, okay, you're 6'3". You ought to weigh between, 185 and 195. 200 should be your top. And every time I see that, and through the years, I've always said the same thing to my physician, is that darn chart updated? Is that the old school stuff? Because, like I said, for me being 205, 210, I thought, hey, I'm in pretty good shape. But then as far as my doctors have always said, well, really, Greg, you're on the high end of the BMI. You're not obese, but hey, you're on the high end of and slightly over what you should be. Now, the only thing they have told me through the years is that with muscle weighing more than fat, that gives me a little bit of leeway, because my 205, 210, if I didn't work out and I didn't have maybe the muscular structure that I have, maybe I would truly be 185, 190. So I guess there's comfort in that, to know that since through the years I have tried to keep up my muscularity. I have extra weight, but there is a reason for it. So really thinking about that, I think for all of us, that's something we need to think about. I know with me, as I'm working through my journey, you guys, I'm hoping that I'm going to be able to have news along the way that, hey guys, my 240 turned into 230 something, 220, 210, 215, because I know that that's important. I know some people don't think it is, do some research, guys. Especially in today's day and age, my God, we don't even know what they're pumping into our food, and things are modified, and hell, we're making some of it, So that in itself is a scary part. But I know when it comes to obesity, that plays into it, because a lot of these foods are increasing weight. You can see it. You can see it with our kids. You can see what you were at as a teenager, a young person, and the way kids are and the young adults are now. Some, no matter how well of a diet they have, they're still going to be heavier than, say, what we would have been at that age, or somebody else may have been at that age. So with that, let me switch gears now to my personal recovery, how I'm feeling. Today, feeling very well. I did have my PT today, my physical therapy this afternoon, and let's just say this, I was not disappointed. I like to call it, I was run through the ringer. Very good workout. I will say I'm also glad that I didn't extend myself very much yesterday, because like I said, today I worked very hard, and I felt, like I said, I felt good. I felt good about it. Right now it's later in the evening. The soreness, the stiffness, the rest of it's coming on to me like it usually does. But still, as far as the hip itself area, in the surgical area, nothing excessive, no swelling, nothing negative like there to talk about. So that definitely is a good thing. So I think what's going to happen now, today being Wednesday, Thursday I'll do a light workout on my own. And then Friday, like I said, I'm going to, Friday I'll see my surgeon, and we'll see what's going to happen there. But I think for me, one of the more positive things that I had done today was the PT was fantastic, but that research of looking to that, maybe in my mind, I'm thinking the recovery should be quicker than what it is, and that's not going to be the case. So now that I know that, and I know that time frame, and I'm looking at a good 10 weeks, 12 weeks, I can live with that, because now that I know that all I care about is to make the progress. If I'm making progress, and if I'm keeping my mind sharp, if I'm keeping my emotions to an even keel, so to speak, where I'm going to allow some lows, but definitely don't allow my lows to get too low, and then allow my highs to get higher than possibly what they really are, then I'm on that path to recovery. And that's really all that any of us can ask for. So with that, guys, I'm going to let you go for the night. I hope everybody has a great night, great rest of the night, and I will talk at you tomorrow. Have a good night. Bye.